Cool. Okay, so I'm Kieran, I'm from iPlato. As we were saying, there's quite a wide range of people here, so either you're already using iPlato and the app that goes with it, or you've never heard of us until about 5 minutes ago when somebody just mentioned us. So I'm going to kind of go through those. Now, to give you an idea of who iPlato are, we are actually dealing with quite a lot of patients already. We've already got quite a lot of practices. We deal with CCGs, trusts, community, so basically anything in healthcare, iPlato's already in that area. I've got quite a few slides because I think it's important for you to actually see how the app works and how things fit together. But in essence, we've got iPlato that links through to EMIS Web. The patient downloads the app, they register to use the app, they can book and cancel appointments, they can enter in symptoms and queries, and then what we're calling pre-GP is the online consultation piece. So again, it gets confusing with the terminology, but if you hear online consultation from iPlato, it is actually pre-GP, and that's the smart triaging element. So again, you'll understand that as we go through. And then the box at the end that's in the dark blue is the digital consultation and video type element. So again, it's a journey. We're not saying that every practice wants to do everything from tomorrow. There'll be practices that don't even do anything online. They're struggling to get patients. So it's a journey, depending on what stage you're at. So again, Files and Wire, practices are already using the app there. So for them, they just want to get onto the pre-GP section. So again, typical slide of what practices are struggling with, the issues that they've got, waiting times, can't get appointments, phones are too busy. So again, that's what we're trying to address. But how it works and how do patients get the app, it's important to understand. It's quite easy. Practice manager, do I really want to be seeing any more patients than I do now? Probably not. I just want them to sort themselves out. So what we do is we just send a link to the patients via text. Now, you can use any mechanism. If you're already using MJOG, you can do that. If you're using iPlato, we can do that. Or you can use your own system. You send that link to the patient and away they go. That link now allows them to get onto the app straight away without any involvement from the practice. We've split out the two actions. So again, it's great getting them in, DNA swabs, blood test, to actually see the patient who it is and give them access to the online activities. But actually, to book and cancel appointments and communicate with the practice, you've already got those details. So we do the onboarding part of the process as part of it. To show you what it looks like, first screen, we're going to have GDPR bingo. I agree to terms. So a lot of people have already been here an hour and I've had 3 inquiries about GDPR. Patients using this app, as soon as they open it up, nobody will read it, but when they click agree to terms and conditions, that's explicit consent. So actually, you're capturing it at the very beginning, so you don't need to worry about GDPR with the app. Once they're in, they type in the phone number and the date of birth, and because we're connected to EMIS in the practice, we know who the patient is, and we'll send them a text straight away so that we know it's that patient. So it's like online banking. We've all got mortgages, bank accounts. I've never seen anybody at the bank. So we're following the same process. You type the code in and it says, welcome Kieran, you're at such and such a practice. So that is a registered patient for our service, and that's full access straight away without anything. So there's no need for them to come into the practice to get letters or anything like that. While they're there, it'd be useful to capture some information. So the first screen the patient sees before they can get anywhere, are you a smoker? So no matter what they choose, we recode it directly back to the medical record, so that's captured straight away. And for the smokers, I want to tell them something special. So I've set the system up, so as soon as they click yes, it fires them a little message that says there's a smoking clinic on a Wednesday, here are the directions and what we do. As soon as they've got the app on the phone, they get a little box that says they've received a message. So again, if you're familiar with WhatsApp, those types of things, if you're an app person, you'll get it, so you understand it. If you're like my dad at 74, he won't even be on that. He's just got an old naff phone that doesn't do anything. So he can still do the normal texting and online services. I can send different messages. So here, there's an example message that says, Kieran, you're eligible for health check. Now, we don't put health check appointments on online, because if you were like my dad, he'd book it, he'd book the smear, if it's there he'll click on it. So what we've done is we put a link in so that they can see it. So again, I put NHS choices. It could be the local practice website, could be the CCG website, could be Domino's Pizza. Whatever you want to put on there and send it to the patient, you can do it, because the link's within the app. Underneath it asks them if they want to decline and if they don't want to do it. Those appointments can be hidden, so only the patients that are in that recall could see those options. So again, most patients log on, they see every appointment. With this, it's specific to the recall group. So if you text 100 patients and message to 100 patients that they're eligible for a health check, well, the ones that are using the app, they could see hidden appointments. Patients can book and cancel appointments using proxy access, so that's already working. So if I'm at a practice that's using iPlato in File and Wire, and there's a practice in Blackpool using it, and my auntie's there, I can add them in. So there's me, and I've got my 2 children. We can send a message through so that they get access. I won't dwell on the age groups 12 to 16 IG. We tick those boxes, and it's up to you to give access to whoever you want. If they're over 16, it's the user themselves that gives access. So it sends that message to them, and at the end, you can see that's me, Homer Simpson, with the 2 kids. So depending on who you click on, you can then book directly into their practice. So currently, I think I've got Lynn's practice in Sedbergh set up, and I can click on Lynn, and it shows me Lynn's practice with all of her appointments. But actually, when I go back to my page, it shows me my appointments. Medication reminders, weight, BP, and monitoring. This is purely for the patients at this stage, so it's very static, and it's staying there for the patients to be able to use it. Although we have commenced a project to get that information either into a portal view or direct to record. Because clearly, if that was applicable in a care home, nursing home, other areas, that would be really useful then for somebody to be able to see it. New scores, O2, pulse, resting rate. So, how do patients book appointments? So what we're looking at now is the pre-GP functionality of how it works. So the patient goes in, they click on book appointment, and it's connected to the clinical system. Oh, skipped along a bit. There we go. It's a couple of clicks to set it up. I don't want to be setting stuff up in EMIS, so what we do is we read what's in EMIS. You want to offer that online, and you can put asthma clinic. If you want to trick the patient, you can call it something else, and they won't know because the buttons are the same. So you can change the way that it looks to the patient. They pop in the reason. So in here, this patient's had a rash on their arm for over a week, and they want to see the GP, so they go to click book appointment. Once that information's gathered, it then goes into EMIS. So again, if you're looking at your clinical setup in EMIS appointment book, that's what it would look like for your appointment book. The information's sat there waiting. Care navigation then switches on, and what we're trying to do is, although the patient's got an appointment booked in 2 weeks' time, because that's the closest GP appointment they've got, again, I'll use my dad as an example, doesn't enter his head to see anybody else. He will immediately want to see a GP. With our system, what we're trying to do is get them off at different points along this line to do something else. So they can either go to the pharmacy and use pharmacy first if that's available. They can either educate themselves, they can have a telephone appointment, they could see a nurse. And if they're adamant, they can still see a GP. So we're quite different in that respect, that we're not stopping the patient. Because the thing is, if we tried to stop them booking a GP appointment, they'd find a way around it. They'd be stood at the door at 8 o'clock in the morning. They'd be ringing up, unless you're taking your appointments off even online. And again, they sit together. The last thing, the second phase for the digital consultation that we mentioned earlier, that's starting over summer. So that's where it'll fall into things like video consultation and enhanced data capture. Because in an ideal world, if somebody's clicking med review, should they not be filling in maybe a few questions as part of that booking process? Should it not be sat in EMIS for me to look at it and assess it? If it was a minor surgery, should it not be a photograph of what they're having done so that they can look at it before the clinic? So those types of things are going to come through as well. How it works at the moment, patient goes on to book an appointment and they're presented with different options. So in this instant, the patient's put in a new concern or a new problem, and then they put in the reasons why they want to visit. Once they pop the information in, they're then presented with a second screen. So here we're saying, well, okay, you've got a GP appointment in 2.5 weeks' time, but if you want, you could book this alternative appointment, which is a telephone appointment, and that's maybe only 2 weeks away. They could view other telephone, so we're trying to switch them to alternatives. If they want, they can switch to that, and it'll ask them to cancel the appointment so they get rid of the GP appointment. We're trying to put them off, so actually we're going to show them nurse appointments next. So again, I've configured this purely for my practice. You could do it at CCG, networks, CCG level, it's up to you how you design it. But I'm saying actually, these are the things that my nurses do. Actually, yeah, it's the blood pressure check that I want. So I booked the GP appointment, well actually forget it, I'll change to the nurse, and the nurse appointment could only be a week away. So we're giving them alternatives throughout the process. And again, how you match them up into your appointment book's entirely up to you. Final chance to try and stop them booking a GP appointment. Yeah. So we've put on services. So again, current experience with my father, GP appointment. I didn't know, because of where he is in East Lancashire, there's a self-referral spine clinic. He's been waiting for a GP appointment. He literally turned up to see them. If I'd have had this functionality and saw spine clinic, self-referral, click here, a call, he wouldn't have gone to the GP, he wouldn't have seen the GP. So here, this is where you can promote services that are your practice specific, or CCG. Again, it's up to you how you design that, but it's up to you what you want to put on there. And again, if you've got, I know that some areas are looking at directory of services and maintaining it themselves, you can actually say, well, Blackpool Directory of Service, click here, and it's a website that lists everything. Some areas have pharmacy first, some areas have got dispensing sites. So again, you can switch these screens off, so if you didn't want the pharmacy one, if you were a dispensing practice, you could switch that off. But here, pharmacy screen, well actually, you're booking a GP appointment, would you not rather go to the chemist, because they're dealing with all of these things here. And again, I know that some areas have got pharmacy med reviews being done at the chemist, so they'll direct them there. The patient can click find pharmacy, and then it'll bring up a map. Pharmacists around them show them which ones are open. Because the app's in the hand, we're starting to get information from them. Last example I'll show you is sick note as another example. A lot of patients just book a sick note appointment. They don't actually even know you don't need one for 7 days. So what we notice is a lot click cancel, and they may come back in a few days. We're not saying it'll stop it, but providing information that they don't actually need a sick note for 7 days. Not many people know that. Contact details. By all means, write those down. I can provide you with any information after today. I'm here for most of the day as well. If you want to give me a phone call, email, I can send information through. Yeah.
Okay, so again, what